Hi everyone, I'm Natalie from My Progression, and in this video we're going to take a look at triggers, what they are, how to look out for them, and how to avoid them. Let's jump right in with what do we mean by trigger? There are two main types of triggers, a psychological trigger that causes a painful memory to resurface, or it can be a stimulus that activates or worsens symptoms of a mental health condition. A trigger can be something you experience in the present that brings back or activates a feeling or emotion from the past. You've probably heard of soldiers who suffer from PTSD being triggered by the sound of fireworks. That sound in the present is bringing back painful memories from the past. People with conditions like autism or OCD could be triggered by an external factor that doesn't necessarily provoke a painful memory, but that triggers or worsens their condition. So what might cause a trigger? The most likely cause for a psychological trigger is previous trauma, and that trauma could be anything. If you imagine we're talking about a child who had been physically abused, a sudden raised voice or slamming of the door might be enough to send them into anxiety. Or if someone was in a car accident, a horn beeping or the sound of a siren might be a trigger. Something to be aware of when working with children is certain days or times of the year can be triggering, especially Mother's or Father's Day. Some of these kids may have lost their parents, so it will be particularly difficult. There's a long list of mental health disorders that will be worsened by certain triggers, but the most common you'll find in an educational setting is ASD, Autistic Spectrum Disorder. For a lot of autistic children, sensory overload will be the cause and the trigger. Whilst every autistic person is different, changes in routine, anxiety, and communication difficulties are very common triggers. Other triggers could be a person in uniform or of authority, a dark room, shouting, door slamming, crowds, overheating, hunger, and certain smells. Odours take a direct route to the limbic system, which is the part of the brain involved in our behavioural and emotional responses. Experts say the memories associated with smells tend to be older and thought about less often, meaning the recollection is very vivid when it happens. I heard a story about a young autistic boy who was absolutely lovely and really calm, except when the deputy head was around. Again, this woman was lovely and had never really had any meaningful or negative interactions with the boy. But every time she was near him, he'd get very emotional and on occasion lash out at her. After months of this happening, they stumbled upon the cause. She happened to wear the same perfume as the boy's mother, who had been abusive. She stopped wearing the perfume and he never reacted that way again. How to avoid being a trigger. In some cases, you may become a trigger through no fault of your own. This could be down to your gender, appearance, or position. In these cases, there are a few options. Remove yourself from the situation. You might not be the best person to work with this child, so don't. Provide them an environment in which they feel safe. There may be a specific room in the setting where they feel comfortable, or it could be they just want to be surrounded by other people. Providing options how and when they will interact with you. When children or young people have a choice or a say, it helps them feel empowered and more confident. This is important. Don't take it personally and don't try and find ways to get past it. If you're not having a positive impact on a child and it's unavoidable, step away. When a child is triggered, they will usually display some signs known as cues. Every child is different and their cues could be displayed in a variety of ways. It's important that you keep a close eye on behavioural changes and note down any observations from an incident. This can be fluid and there may be new cues that become apparent with time. See our video on stages of a crisis for more information on what can happen before, during and after crisis. And while you're there, like and subscribe to keep hearing more from My Progression. A child's cues may come in the form of facial expressions, nervous tics, changes in speech patterns, sweating, feeling ill or sick, becoming quiet or withdrawn, complaining or getting irritable, exhibiting signs of fear or anxiety. And after close observation, you should be able to anticipate a child's triggers, avoid them, and then know what to do if a child is entering anxiety. Sharing good practice between educational professionals is always advised. If you have any examples of how you've anticipated or dealt with triggers, pop them in the comments below. What should you do? If it's your first day in a school or educational setting, the first thing you should do is familiarise yourself with their policies, procedures, and any relevant information about the children you're working with. Speak to the other staff. Is there anything you need to look out for or avoid to prevent triggering a child? If a child is triggered, the best thing for you to do is distract them, divert their attention, and encourage them to do an activity that you know they enjoy. You must display calm and relaxed body language at all times. You do not want to be the reason this escalates. Sometimes all you need to do is just remove them from the space and give them some quiet time. One thing you need to be really careful of is pushing a child to tell you what's wrong, especially as a lot of the time they won't actually know. Something to be aware of is the cognitive ability of a child. When it comes to children and young people, they're less likely to be able to identify and control their emotions when confronted with a trigger. Whenever a child lacks the skills to effectively respond to or manage a trigger, acting out occurs. Typically, a child will move from concrete operations, the ability to understand basic concepts, add and subtract, to formal logical operations from ages 12 to 18. Formal logical operations includes the ability to do abstract thinking. This means thinking about possibilities, reason from known principles, forming their own new ideas, consider many points of view, and to be able to think about the process of thinking. So if you consider that, how would a child be able to fully understand what was causing them to act out or become distressed? They can't. It's up to you to understand what their triggers are, what's the likely cause of them, and how to ensure you don't become one. Communicating these cues to staff and other caregivers around you helps ensure consistency in all environments. Discuss specific cues and triggers, as well as appropriate responses to them, and familiarise yourself with the background of all the children in your care. Many schools and settings will have fact sheets in the staff room with all of the key information you need to be aware of. It's your job to know this and make everyone aware of any changes. To summarise, triggers are usually linked to trauma or can worsen a mental health condition. It's your job to know what might trigger the young people in your class or care. Knowing this will help you avoid triggering them. Look out for cues that a child is entering anxiety or crisis, and then divert their attention if needed. Avoiding and understanding triggers will allow for a safe and happy environment. I've been Natalie from My Progression, and if you found this video on triggers helpful, then please subscribe to our channel for more on working in education. And let's keep your career in motion.